Hi everybody, this is Dr. Simmons. I'm actually back here to give it some more talks, try to educate everyone so that we can know what's going on with coronavirus. So once again, I'm here giving a talk with a partnership through for Ola Health Solutions, All Children's Pediatrics, Low Country Head Start, and Beaufort-Jasper EOC Head Start. Basically, these will be a series of talks on dealing with parent and family concerns about COVID-19 and other topics of interest, as well as user-submitted questions. Basically, we'll also talk a little bit about telemedicine, some of the services that we've offered through All Children, and also basically through All Children's Pediatrics and some of the Head Start families. So as far as telemedicine services, if your child is sick, you won't have to leave home. You can basically contact us through telephone. Also, you can contact us through video conferencing, and you will actually be able to see a medical provider instead of talking to a nurse. We're actually trying to offer a lot more services to our families in this time of need. So what's today's talk about? I want to talk a little bit about germs. Basically because I think in the context of what's going on nowadays, we need to have a better understanding about the virus. And so I want to kind of give you guys a little more of a basic talk on some things to help you understand COVID-19 better. When we think about germs, we think that germs are bugs or cooties or really gross stuff. Actually, germs are really tiny organisms that cause disease. They are so small that they're able to sneak into our bodies without being noticed, and that's how sometimes we get infections. As far as germs are concerned, there are about 3 or 4 major types of germs. The first is called bacteria, and these are tiny one-cell creatures that get their nutrients from the background. An example of a bacterial infection might be strep throat or an impetigo skin infection. Some other things that we see as far as fungus infections are concerned or germs are concerned would be fungi. Fungi are multicellular organisms, kind of plant-like in some ways, but they get their nutrients from the background as well. Some examples of fungal infections are things such as athlete's foot or yeast infections that women and babies or men can get from having taken antibiotics or having been on steroids at some point in time. Other types of infections that we see, or germs that we see, are called protozoa. Now these are basically one-cell organisms that love moisture and they spread disease through water or through bugs. One of the most common causes of a protozoal infection is malaria, and I think we've all heard of that. That's actually responsible for most of the death caused by organisms or animals in the world. Now, the last type of organism or germ that I want to talk about is the virus, and that's the one that's causing most of the problems nowadays. A virus are super tiny, much smaller than bacteria, much smaller than our own cells. That's how they get inside of our body. To kind of give you some perspective, if our bodies were bacteria, if our bodies were bacteria, a virus would be the size of an actual bacteria or smaller. So they are so small until they can infect bacteria, they can infect our cells, they can even infect other viruses. That's how small they are. They can only be seen through a special type of microscope called an electron microscope. So this is really tiny. Unfortunately, antibiotics do not work for viruses. Viruses cause things like the common cold, chickenpox, measles, flu, and of course they cause COVID-19. Basically, how do viruses infect? I'm going to, like I said, break down some of the basic stuff for you guys. Viruses infect cells by escaping our normal guard cells in our immune system. So basically, once they get past our normal immune system guards, they're able to infect the cells. This process begins by a virus actually attaching to a host cell or to one of your cells. And so in the case of COVID-19, it really likes our respiratory tract a lot. So when the COVID-19 virus attaches to a respiratory cell, it injects its DNA or its genetic material into that cell. What happens at that point in time is that the virus's genetic material actually hijacks that cell's genetic material, so it infects the respiratory cell's genetic material, and actually that cell starts to make a whole bunch of new viruses within itself. Once it has created so many viruses, it actually pops. And once it pops open, all those new viruses are released into the body, and actually they start infecting other cells. Once that cell pops, it dies. So that's why you start getting cells that die from viral infections, because they pop open, but when they pop, they release a whole bunch of new viruses that actually cause more infections. And that's how viral infections spread throughout the body. Once these viruses have multiplied and produced enough, then you become symptomatic. However, about 2 to 3 days before you have any symptoms, you can actually be contagious because the virus is actually already inside of you, causing the damage to your cells and actually growing and multiplying. So, as far as how a virus is spread, different viruses are spread differently. You might hear somewhere some people are saying that that COVID-19 is in the air, and it's not. That is not one of the primary ways that this virus is spread. This virus is spread through droplets or coming in contact with others. This basically means that COVID-19 is spread by larger droplets, so you have to cough or sneeze on someone. Some viruses that may be spread through aerosolation or easily spread in the air more are things like chickenpox. So let me give you an example. If you're in an elevator with someone who has chickenpox and they're breathing the same air as you, that virus is so small that it can float through the air and spread that way. COVID-19, in the majority of the cases, is not spread through that way. You have to cough, you have to sneeze, you have to actually touch something that's actually been infected. Now, what makes viruses different is the fact that they cannot live outside of living objects. So if a virus goes onto a surface, plastic or cardboard, it can only live for a small amount of time because they are not able to live outside of a living cell. And so, to give you an example, the average lifespan of COVID-19 on a piece of cardboard is about 1 to 2 hours. The average lifespan of COVID-19, or the virus that causes COVID-19, on plastic or stainless steel is about 12 to 24 hours. So that's why they're saying you gotta wash your hands. As a matter of fact, we think that one of the primary ways that COVID-19 is spread is through touching infected objects. So wash your hands, do not touch your face. So now let's talk about viruses being spread. Viruses are spread through a process that we call contagiousness. I'm make it as simple as possible. And contagiousness means how well a virus can infect someone else. When we look at COVID-19, its rate is about COVID-19's contagiousness or infection rate is to the point where it infects 2 to 3 people for every person that's infected. So if you have COVID-19 and you have an infection, the average person that's infected is 2 to 3 people per person that's been infected. Hope I explained that one pretty well. All right, so now that I've kind of given you a breakdown on the different types of germs and giving you also a breakdown on what viruses do and how viruses work, that's why it's important to understand this process, because there are a lot of myths and things out there that people are saying that just aren't true. But if you understand how viruses work and how viruses spread, that actually combats a lot of the myths that are out there. So let's talk about some of the myths that are out there. First thing I'm going to do is talk about COVID-19 and what it actually means. COVID-19 is the disease caused by the virus. The virus's official name is SARS-CoV-2. That's because this virus is not wholly different. It's not really new. This virus was first seen back in 2003, and it was called SARS. The current virus is actually 96% the exact same virus. So this is not the first coming. This is the second coming. Now, a lot of people are saying, well, we're worried about conspiracy about this being a man-made virus, a government-made virus. It's not. This virus, we have seen viral outbreaks for hundreds and hundreds of years. Whether it is the cholera outbreak that we saw back in 1812, we saw back in, I believe, in the 1700s, whether it's the Spanish flu that we saw in the early 1900s, I believe around 1918, 1920, or whether it's the coronavirus that we're seeing now, the coronavirus that causes COVID-19 we're seeing now. These things are cyclical. They come about every 100 years. So just understand that they probably will work on a vaccine, because this is not something that's wholly new. What is new is the extent to which it has spread throughout the globe, and it actually has disrupted the way things work throughout the globe. So myth number one that I've been hearing on the internet: gargling with hot water makes this better. That the virus does not like people who gargle with hot water with or without salt. So to combat this, you have to understand how viruses work. Viruses do not live outside for very long times outside of living cells. So if the gargling with the hot water is actually killing the cells and the sinus passages, then that might work. If the gargling with the hot water does not kill the cells that the viruses infect, then it's not going to affect the virus at all. So as far as my concern, myth number one, stricken off. Gargling with hot water does not help. It will make you feel better, because just like because this virus has similar symptoms to the common cold, a lot of congestion. Gargling with hot water and that stuff might make you feel better, just like it might make that common cold feel better. But COVID-19 is not the common cold. Another myth is out there that children do not get sick. Children get sick and they spread the virus. Their infectious fatality rate, so they don't die as much as adults do, but they definitely get sick. And they may not get as sick, but they're getting sick. As a matter of fact, because everyone thinks that kids are not getting sick, they're actually probably being exposed to individuals more and actually spreading the disease more. So we really want you to understand that children can spread the disease, children can get sick, and there are a few preliminary reports of some kids who have either died or have some worsening of disease because of it. But for the most part, please understand that this disease affects adults mostly if you're immunocompromised, although we're starting to see some of the younger individuals affected. Another thing that I've seen out there is that ibuprofen makes COVID-19 symptoms worse. We're seeing a lot of misinformation out there. I mean, it's coming out in volumes. My advice is when you see anything that says a drug or something that makes it worse, check the FDA website. They're actually doing a lot of studies trying to figure out what works and what doesn't work. And I can tell you that it has not been shown in any way that ibuprofen makes COVID-19 symptoms worse. If you look at it, actually, I think that they're actually pretty good about dispelling this myth pretty quickly. And so, last but not least, I want to break down a little bit about social distancing versus self-quarantine, because I'm seeing a lot of confusion with this, and I'm seeing a lot of people who are kind of getting confused and actually violating the principles of both. So let's talk about social distancing. Social distancing is deliberately increasing the physical space between people to avoid spreading illness. As far as COVID-19 is concerned, we found that about a 6-foot distance between individuals limits the spread of disease, or limits the probability of catching COVID-19. So we kind of know what social distancing is. We've heard a lot about it on the internet and on TV. So let me ask them some questions about COVID-19. So some questions that I've been asked is, can I go to a restaurant, food court, or bar? We do not recommend you going to a food court, a bar, or restaurant, except if it's a drive-through. Once again, we found that this actually is a great principle of social distancing to limit our exposure to sick people and the possibility of getting in contact with infected objects. What about visiting grandma or grandpa? We do not recommend that you visit grandma or grandpa at this point in time because they are the highest risk population. So if you do go, washing hands, and basically try to keep them as safe as possible, because they are the ones who are actually getting affected the most. And so someone says, but I'm a healthy grown-up, not a kid. Is it okay to visit my elderly relatives? No. The problem is, remember, viruses are, you consider contagious with a viral infection 2 to 3 days before you have any symptoms. So you could very well walk in the house and pass it on to your grandmother or grandfather. So please protect them, if not protect yourself. Another question is people are saying, I still need to go to work. Is it okay to drop my kids off at daycare? This is actually a pretty big question, because not everybody has the freedom to not work, and you have to do something with your kids. Basically, what we're recommending is if you have to do it, try to find a daycare setting with a smaller number of kids. If your kids are sick, do not send them to daycare. And please make sure your children have had the flu shot, because while it will not protect you against COVID-19, it will prevent them from getting some of the other illnesses out there that might complicate our diagnostic process or helping us make a diagnosis of COVID-19. So these are some of the basic principles I suggest that you follow as far as choosing a daycare. All right, next up, basically, our kids' play dates, okay? We do not recommend play dates because it kind of defeats the purpose of everyone hunkering down and practicing social distancing. You don't know where the kids have been, you don't know where the parents have been, and so they could very well be passing on the virus at that point in time. So we would definitely recommend that you not do play dates. Basically, someone is saying, what about playing outside with other kids or going to the parks or running? You can go outside, you can go for a run, but please practice social distancing. Stay 6 feet away from individuals. We don't recommend going to the parks because, once again, the virus lives on those objects for anywhere from 12 to 24 hours to stainless steel and the plastic. So you don't know where someone who's been there, so we recommend staying away from that. As a matter of fact, I'm still seeing some of the younger individuals, teenagers out playing basketball. Listen, you guys, if you're playing basketball, you don't know what you're transmitting back and forth. If you're out and you're hanging out at the skate parks, you could very well be the ones who are transmitting this virus back and forth. So please, we try to avoid those areas, try to pull it back for a little while so that we can all be safer. Basically, for the most part, try to avoid social visits. And we're talking, don't do cookouts, don't do social gathering. This is not a vacation. This is a chance for us to limit this disease and get things back on track a lot better, a lot faster. So basically, someone is asking about doctor's visits. If it's something that's essential, we recommend that you go to your doctor's office. If you have a fever, contact the doctor's office or hospital before going in, because they all tend to have some infection protocols in place. At All Children's, what we're doing is we're trying to avoid having patients wait in the waiting room. Everyone comes straight back to the exam room as soon as possible. We're actually checking everyone, including the parents' temperatures, and we recommend you bring in as few individuals as possible into the office. Otherwise, we are offering telemedicine service to all our patients as well. So if your child is sick, you can call us and we're able to do video conferencing as well as telephone and take care of our patients, because we realize that these are extraordinary times. Someone else is asking us, can I go to the grocery store? Yes, you can, because if it's essential, you gotta eat, you gotta get the medication, the things that you need. But we recommend social distancing, and social distancing. Just basically keep your space. If someone's sick, send someone else, but don't go to the store. All right, so let's look at self-quarantine. Bit different from social distancing. Basically, this is the way that it is. This is when you stay home and you don't go out, and you basically limit your contacts in a very significant manner. Basically, what I'm telling everyone is, if you're sick, self-quarantine. If you got a fever, if you're having cough and congestion with or without trouble breathing, self-quarantine yourself. Go home. This means that your friends shouldn't visit you. You shouldn't be going to work. You shouldn't be coming in and out the house. You shouldn't go visit grandma. Stay home, because you need to be self-quarantined. Especially if you have a positive test for COVID-19, or if you have been tested and the results are not back. You have to remember that if you have been tested, you may still be contagious, so we need you to really limit your contact as much as possible. Basically, I'm going to give you guys a quick corona update as far as South Carolina is concerned. You know, we have over 400 cases currently in the state. I believe in Beaufort County, we have over 30 alone. If you have concerns about COVID-19, contact your local hospital, their websites. They've actually been pretty good about getting information up. Contact DHEC, they've actually been excellent. Their website is excellent. CDC's been excellent as well. If you like the videos, like us on Facebook. It's for OLA Health Solutions, All Children's Pediatrics, or you can just like my own personal webpage. If you are a member of the Beaufort-Jasper EOC Head Start or the Low Country Head Start, your children and families automatically qualify for our telemedicine services. And basically, once again, if you're All Children, you automatically qualify. All right, I'm about to wind it up. Remember, wash your hands, don't touch your face, love your families, and stay safe. Love you. Take care.